My name is Dr. Leon Fu. I'm a Consultant Orthopaedic Surgeon with Island Orthopaedic Consultants, and I'm based at Mount Elizabeth Hospital. My subspecialty interest as well as fellowship trainings in two areas. The first area is in Orthopaedic Oncology, which is bone and soft tissue tumours. And the second area is in joint problems, be they cartilage regeneration issues, joint replacements for arthritis, and sports injuries such as ligament tears. Two main reasons. The first one is influence from my uncle, who was a senior orthopedic surgeon. And the second, which is actually more important to me on a personal level, is the fact that I wanted a profession in which I would be interested in for the next not just 20 years but 40, 50 years of my foreseeable working career. And medicine has that beauty in the sense that you're always learning. You're learning from patients, there's new technologies, there's new understanding of diseases. It's something that will keep you interested, prevent that midlife crisis that many guys go through in their 40s and 50s. Well, I think one of the most difficult moments, and it's not a singular event, it comes on quite frequently in our practice, is trying to understand the patients, their expectations, their hopes, their fears, and also of their family, what the children hope for the parents. A classic example would be, in my case, I specialize in Orthopaedic Oncology, which is bone and soft tissue tumours, so I deal a lot with cancer, and breaking the news of a cancer to a patient and his or her family can be very, very challenging. There's patients who don't want to know, prefer not to know. There are patients who say, no, I want to know everything. I want to know all the options so that I can make a decisive decision quickly and live. On the other hand, there are the family. Some of the children, they care and they love for their parents, but they don't want them to be unduly shocked by this diagnosis. They say, please doctor, don't tell them the real diagnosis. You can hint at it, but don't tell them the big C word, the cancer word. Yeah, so there's a lot of grey in medicine, and that's a difficult area because from an ethical point of view, we are obliged to tell the patient everything because that's our duty of care is only to the patient. But we have to hear different perspectives and to find what's the right path to walk in this area of grey. I like to think that I can read this over the years better, and I'm improving each time as I see more and more patients over the years. Actually, more than one proud moment. There's no singular proud moment. Always happiest, very much like a parent, a proud parent if their children have done well. Happiest to see my patients do well after surgery or even after conservative treatment. That they're able to go back to work, back to their family, back to sports, that they made the correct decision with the treatment. And I'm glad to say it's more than one happy moment for me. Just one guiding principle: patient-centered holistic care.